Katie. I'm a student nurse.
Hi, I'm Maya.
Hi, Maya. Is that how you'd like to be addressed?
Yes.
All right, great. So first off, I'm going to ask you, what's your familiarity with advanced practice nurses?
Well, my friends in school to be a nurse practitioner.
Oh, that's wonderful.
Yeah.
Okay, great. Well, I'm a student. I'm at the University of Illinois, Chicago. I'm studying the grad entry program. And my role is to practice the skills I've learned in class so I can apply them as a nurse when I grow up, or not when I grow up, but when, you get it. All right, and, but anyways, such as this health history that we're going to be completing.
Okay.
Anyways, so what brings you in today?
I just wanted to get a regular, like a health assessment.
Okay.
History.
All right. And how would you describe your overall health status?
Pretty healthy.
And when was the last time you saw your healthcare professional or your doctor?
Last August.
And what was the reason for the visit?
Just a regular physical.
Okay. And have you had any significant or past significant or chronic illnesses, mental health or behavioral issues?
Nope.
All right. And do you have any concerns relating to your health?
Nope.
All right, or well-being. Great. So now we're I'm gonna go over some past medical history. So are you have you had any immunizations?
Yes.
Okay. I'm gonna ask you about some specific ones, such as the tetanus, diphtheria, or the Tdap vaccine. Yes. Do you know when you had that?
I had the booster last August, 2018.
Okay. August 2018. And have you gotten tested for tuberculosis?
Also 2018 of August.
Okay.
August 2018.
And what were those results?
Negative.
Wonderful. And are you up to date with your yearly flu shot?
Yes.
Oh, great. If not, I was going to offer you one. And have you had your pneumonia vaccine?
No.
Okay. And are you vaccinated for hepatitis B?
Yes.
And when was that?
Also 2018.
All right. And just to clarify, when did you get your flu shot?
In, I believe, was September 2018.
Okay, perfect. And have you had any recent exposure to communicable diseases such as hepatitis B, tuberculosis, measles, mumps?
Nope.
Great. Do you experience any allergies to seasonal or environmental factors?
Nope.
Do you have any allergies to any drugs or medications?
Nope.
And more specifically, are you allergic to penicillin? Are you allergic to latex?
Nope.
Great. Have you ever been hospitalized?
No.
Have you had any surgery or invasive procedures?
Nope.
Great. And if you did, I would ask you if you had any complications, but you haven't, so that's great. Have you had any accidents, injuries, or harmful ingestions?
No.
And that includes drinking poison or?
No.
Okay. Do you take any medications?
Nope.
Any prescribed, over-the-counter, herbal remedies, supplements? Okay, great. Do you use any complementary or alternative therapies? Not limited to, but including acupuncture, traditional oriental medicine, chiropractic, prayer, or special diet or vitamin therapies?
No.
All right, great. So now I'm going to ask about your family history. Are your grandparents still alive?
No.
No. Oh, okay. And how old were they when they died?
Well, Mom's dad was 90.
Okay. And what was his cause of death?
Natural causes, I think.
Okay. And how about Mom's mom?
Mom's mom was 95.
Right.
Also natural causes.
Okay. And how about Dad?
Dad's mom was 84. That was from a heart attack.
I'm sorry to hear that.
Thanks. And Dad's dad was 87, and I believe that was natural causes too.
Okay, great. And how about your parents? How are their health status? Are they alive and living?
Yeah, both alive and living, both healthy.
Okay.
No illnesses that we know of.
Okay, great. Any siblings?
Nope.
Oh, an only child?
Yep.
Me too. How about any aunts or uncles?
Nope. They're also only children.
Oh, wow.
Yeah.
That was really nice. And do you have any children?
No.
Okay. And so, are you married?
No.
Okay. All right. So we don't need to ask about the health of your spouse. So I'm going to ask about some certain presence of some diseases and things that maybe in your family history. Just tell me yes or no. Do you have any presence of allergies in your family? Asthma?
Nope.
High blood pressure?
Nope.
Heart disease?
Nope.
Stroke?
Nope.
Diabetes?
Nope.
Cancer?
Nope.
Thyroid disease?
Nope.
Blood disorders?
Nope.
Obesity?
Nope.
Vision hearing problem?
Nope.
Birth defects?
Nope.
All right. Neurological problems, including seizure disorders? Emotional problems? Any mental illness?
Nope.
Cognitive disorders?
Nope.
Learning disabilities?
Nope.
Behavior issues?
Nope.
Any drug or alcohol abuse?
Nope.
All right. And are you concerned about any illnesses of your family?
No, we seem to be all pretty healthy.
Oh, that's good. All right. So now we're going to move on to your personal and social history.
Sure.
So who lives with you at home?
I live alone.
Oh, okay. And what is your occupation? What do you do?
I'm a student in grad school.
Very nice. Where are you in school at?
UIC, actually.
Oh, wow. Is that the only job you've ever had, just as a student? Or?
Yeah.
Oh, okay.
Never had a job.
So you've never had a job change or changes of school because of health problems or occupational risks? All right. Or have you had any exposure to violence as being a student?
No.
Okay. All right. How do you perceive the adequacy of your finances? And this includes like insurance coverage for primary care and emergency visits, and the ability to live comfortably without any stress.
Yeah, I live pretty comfortably, and I have health insurance through the school program.
Insurance through school. And you said you're a student, so how many years of education have you completed?
Well, I'm in my second year of grad school.
Okay. So more than 16 years?
Yeah.
Okay. And now I'm going to ask about some habits. So do you use currently any alcohol or tobacco products?
No.
Do you use any, and by tobacco I mean cigarettes, snuff,
No.
chew? Okay. Do you drink caffeine?
Mm-mm.
Oh, impressive. A student who doesn't
Yeah.
drink caffeine. Do you any recreational drug use?
No.
All right. And how often do you sleep at night? How many hours do you sleep at night?
8 hours.
8 hours?
Mm-hmm.
And do you have any disturbances? You wake up during the night? You go,
I sleep like a rock.
nice. And do you exercise?
I do.
How often do you exercise?
A couple times a week. I like to go swimming. I swim at the
Oh.
pool in the gym.
At the pool, in the gym. And how long? You said a couple times a week.
Mhm.
And how long would you say you swim for?
About an hour.
An hour each time. All right. And so now I'm going to ask about nutrition. So in the past 24 hours, what were your meals like? We'll start with breakfast and move throughout the day.
Okay. Well, I had oatmeal for breakfast with a cup of fruit.
Okay.
For lunch, I had chicken and some vegetables. And then for dinner, I had a portillo chopped salad.
And then you said some vegetables. How many veggies would you say it was?
A couple baby carrots.
All right. And a portillo's chopped salad for dinner. Did you eat any snacks?
No snacks.
All right. And how many glasses of water would you say you drink?
4 bottles.
4 bottles? Like 12-ounce bottles,
I
16
think those
ounce?
Ice Mountain bottles.
Oh, okay.
Yeah.
12 ounce. Okay. And how many times a week would you say you eat out or go out to eat?
I don't usually, actually.
Oh, okay. And do you have any specific dietary practices, like vegetarian, vegan, pescatarian?
No.
No? Okay. So now I'm going to ask you about stress and coping. How much stress would you say you have in your life?
I'm not usually stressed, but once in a while, I do get stressed with schoolwork.
And how do you cope with that stress?
I have to go for a walk, or I talk to friends.
And do you see any outside help from mental health professionals or clergy of your church?
Nope.
Okay. Now, I'm going to ask you about exposure to violence. Have you or any of your friends or family witnessed or been exposed to or subject of violence or abuse. And this includes verbal, physical, or sexual abuse.
Yep.
Cool. And so now we're going to talk about some safety.
Okay.
My favorite subject. Do you wear a seatbelt when do you drive?
I do.
Okay, do you wear a seatbelt?
Yes.
Okay. And do you ride a bike?
I do once in a while.
Do you wear a helmet when you ride a bike?
Yes.
Great. Do you have a functional smoke detector in your house?
I do.
Carbon monoxide detector?
Mm-hmm.
Great. You said you live by yourself?
Mm-hmm.
Correct. Do you own a gun?
I do not.
Okay. And so now I'm going to ask, have you had any current or past exposures to health hazards of the home, work, or community environment? And now these health hazards include crime, violence, pollution, secondhand smoke, or lead, or increased lead or radon exposure.
No.
And what's the source of your water?
I usually drink the Ice Mountain water bottles.
The water bottles.
Mm-hmm.
So, and it's quality and safety.
I would say yes.
It's FDA approved.
Yeah.
Do you have any specific religious practices?
No.
Is there anything related to your faith that would affect your health care?
No.
Okay. So now I'm going to start I'm going to go through each system of the body, and I'm going to ask about certain symptoms and ask you some questions about things related to that body system.
Mm-hmm.
You can answer with a yes or a no. If it's a yes, I'll have to follow up with some questions. Do you understand?
Yes.
Okay, great. Let's start. You ever have any fever, chills?
No.
Malaise or feeling really not good?
No.
Any fatigue, night sweats? Any recent weight change that includes gain or loss?
No.
Are you at your preferred weight, or would you like to lose some, gain some?
I'm pretty happy where I am.
And, excuse me. On a scale from 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced, what would you rate your pain?
0.
And have you noticed any changes on your skin?
No.
Color discoloration. Okay. How about any moles?
Nope.
Okay. And any thinning or thickening of your nails?
Nope.
Any changes in your nails? Okay. And how often do you use sunscreen?
Whenever I go outside.
And so I'm going to ask about, so the condition of your hair or any changes in the scalp, including irritation, itchiness. Have you noticed any textural changes in your hair? Is it getting thinner or thicker,
Nope.
feeling coarser? Have you had any hair loss
No.
recently? Okay, that's good. And I see you wear glasses.
I do.
So when was the last time you had your eye exam?
Last October of 2018.
And was it an ophthalmologist that you saw?
Yes.
And do you have any issues with your eyes, including glaucoma, cataracts?
No.
Are you nearsighted or farsighted?
Nearsighted.
And so have you had any hearing loss?
No.
Okay. Any pain or discharge from your ears?
No.
Any ringing in your ears or tinnitus?
No.
Ever experienced vertigo, where you feel like the room is spinning?
No.
Do you use hearing aids?
No.
So do you have any frequent colds or frequent runny noses, such as rhinorrhea?
No.
Do you have sinus pain or sinus infections?
No.
Any epistaxis, also known as a bloody nose?
No.
How often do you brush and floss your teeth?
Twice a day, both.
Twice a day, brush and floss. When was your last visit to the dentist?
December 2018.
And do you have any missing teeth or dental issues?
Nope.
Cavities?
Mm-hmm.
Nice. So I'm going to talk about your neck. Any stiffness, swelling, lumps, or tenderness?
No.
Any presence of a lump or soreness in your breasts?
No.
Any discharge from the nipple?
No.
How often do you perform a self-breast exam?
Once a week.
Once a week?
In the shower.
Best time, right?
Yeah.
And when was your last mammogram?
I never had one.
Are you interested in getting one?
No.
So now we're going to talk about the chest and the respiratory. Have you have any cough,
Nope.
Ever coughing things up?
Nope.
Do you ever have shortness of breath?
Nope.
Wheezing?
Nope.
Do you have a history of asthma?
Nope.
All right. And how about any chest pain?
Nope.
Any hypertension or high blood pressure? Heart murmurs? Hyperlipidemia or a lot of fat in the blood?
Nope.
Okay. Have you ever had any do you have any diarrhea or constipation?
Nope.
What are your bowel patterns like?
Pretty regular, I would say.
How often would you say you have a bowel movement?
Once a day.
Once a day. And do you have to strain when you have your bowel movement?
No.
Okay. No straining. Any nausea or vomiting?
No.
Abdominal pain? Do you have any food intolerance, like glucose or lactose intolerant? Can't drink milk?
No.
All right. Any rectal bleeding?
No.
Any swelling of the glands in the groin?
No.
All right. How often do you pee?
Whenever I need to.
Good for your kidneys.
Yeah.
And do you have any pain when you urinate?
No.
Any blood in your urine or hematuria? Do you have any incontinence? So like you pee when you're not controlling
No.
uncontrolled urination, when you giggle or laugh?
No.
Okay. Any flank pain or pain where your kidneys are more towards the lower center of your back? Any infections, including sexually transmitted infections or urinary infections?
No.
All right. And any vaginal discharge?
No.
And when was your last menstrual period?
Last month.
And do you know what day it was?
I believe it was the 18th.
I can never remember when the last day was.
Yeah.
I just remember it was a month ago. And what's your typical cycle? Is it usually
28 days.
28 days?
Yeah.
And is it a heavy flow, light flow, moderate?
Moderate.
Okay. And how old were you when you got your first period?
9.
And when you're menstruating, do you have any cramping?
No.
Do you get any premenstrual symptoms?
No. I'm pretty lucky.
Headache, yeah, okay,
Yeah.
great. That's, yeah. Have you ever been pregnant?
No.
Any issues with fertility?
Not that I know of.
Okay. Do you use any contraceptives?
No.
When was the date of your last pap smear?
I never had one.
And if you've never had one, you've never had a normal pap?
No.
Are you sexually active, including oral, vaginal, or anal sex with men or women or both?
No.
So you're not sexually active?
No.
Okay. And so have you ever had, how many partners do you have currently?
None.
Oh, okay. And so how many lifetime partners have you had?
No.
Okay. And do you use condoms, foam, or other contraceptives? Okay. No need if you're not sexually active, right? So I'm going to talk about the musculoskeletal system, arms. How is your ability to perform your daily acts of living?
That's fine.
Dressing, grooming. Okay. Do you have any limitation with range of motion? So do you have struggle reaching up top for things or bending over to pick things up?
No.
Any swelling or weakness in your joints, and muscles? How about pain or stiffness in joints or your back?
No.
All right. Any trouble walking with or an impaired gait? Okay. And now neurologically, so we're going to talk about that. Have you had a history of head injury? So any loss of consciousness, loss of coordination?
Nope.
Okay. Any dizziness?
Nope.
Numbness?
Nope.
Tingling?
Nope.
Any history of seizures?
Nope.
Any tremors?
Nope.
Headaches?
Nope.
Impaired cognitive functioning?
Nope.
Any memory impairment?
Nope.
Any irritability or mood swings?
Nope.
And have you ever had anemia or been anemic?
Nope.
Okay. And that means low iron in the blood. What are your excuse me, your bleeding tendencies? Do you bleed a lot? Do you not bleed?
Just average.
Okay.
Yeah.
Have you ever had a history of blood transfusion?
No.
Any thyroid problems?
Nope.
Hypo? Do you have unusual sensitivity to hot or cold environments?
No.
All right. And do you ever have polyuria, polyphagia, or polydipsia? I mean, do you pee more than you should? Are you excessive hunger and excessive thirst? And how would you describe your daily mood?
Pretty happy.
And have you had any past or present mental health issues such as anxiety, panic or panic attacks, depression,
Nope.
mood swings,
Nope.
hallucinations,
Nope.
eating disorders,
Nope.
suicide attempts and ideation. Have you ever attempted to kill yourself or tried to kill yourself? Okay. Well, thank you for all the information that you have provided. Is there anything else about your health that you may be concerned about?
No.
All right. Well, great. And thank you so much,
Thank
Maya.
you.
It's wonderful
Thank
to
you.
meet you.
You too.
Thank you.